Welcome back. Now, did you know that for every 10 babies born, one is a preterm, and that for every 40 seconds, one of these babies dies? This is according to a report released by the United Nations Children's Fund titled Born Too Soon, a decade of action on preterm birth. However, an impactful collaboration to improve maternal and newborn health has significantly enhanced healthcare services aimed at preventing, detecting, and treating complications associated with premature birth. KTN's Chebet Birir reports. Take a look.
At the Kenyatta National Hospital's newborn unit, 22-year-old Juliana Mumbua sits quietly. She is reflecting on the ordeal she faced after giving birth to her first child. On the 29th of August 2024, Juliana's baby was born prematurely at just 6 months in the most unexpected way. She was at home when the labor pains kicked in, catching her unawares as the overwhelming reality of her situation sank in.
Nilikuwa na msichana mwingine lakini hiyo time sikuwa naishi chochote. Mchungu tu ilikuja tu na mtoto tu akatoka. Akitoka tukakaa tukampeleka tu hospitali.
Upon arrival at this referral facility, Juliana's baby was immediately admitted to the nursery where the doctors worked tirelessly to stabilize the little angel. Unfortunately, the baby later developed an infection in the stomach, adding more stress and anxiety to Mumbua, who was already overwhelmed.
Nilijifungua the 29 August. Lakini nilijifungulia kwa nyumba hiyo day 29. After kujifungua nikapeleka mtoto hospitali. Akakaa tu kwa nursery.
For Juliana, the journey was not just about physical recovery, but also about learning to care for a vulnerable infant. The doctors at the hospital emphasized the importance of hygiene, as premature babies are highly susceptible to infections.
We screen their eyes, we screen their hearing, so that by the time a baby is getting to the toddler and the growth phase, if there are any problems, they've been picked and the necessary referrals have been made.
Susan Muraya is a 29-year-old mother of 3 and a resident of Nairobi. She gave birth prematurely on October 11th, 2024. Her baby arrived at 7 months, 2 months shy of the normal 9.
Ilikuwa tu normal. Nilipata mtoto akiwa amefikisha miezi 9. The second was the same, but ndio tu ilikuwa na different kidogo. Which imekuwa challenge kwangu. But for now naenda nikiadapt.
Through the support of the medical staff, Susan has started to accept her child fully. She has since accepted the reality of her situation, not wanting to meet the consequences of ignoring it.
Naweza ambia mtu akiwa na mimba asi overwork sana, cause ilichangia pia ku overwork, stress. If kuna kitu inakusumbua, just try to ignore it. Ukijipa stress inachangia pia kupata mtoto mapema, na ni kitu ngumu, si rahisi kulea mtoto kama huyu.
For many mothers, the cost of extended hospital stays, medical care, and the need for specialized equipment can be overwhelming. Mercy Phillips, a 28-year-old revenue collector from Machakos, reflects on her challenges. She gave birth to a baby weighing just 500 grams at 23 weeks.
Nilikuwa na pain, so nilikuwa nasema better atoke hiyo pain iishe. Sasa hiyo pain ilikuwa imenikalia. Nililia lakini siku lose hope. Penye alikuja nikaomba Mungu nikasema nimepata mdogo lakini nisaidia kuwe mkubwa.
Mercy's story is one of resilience, which also exposes the harsh realities of being a mother to a premature baby in Kenya.
Tulikuwa tunaendea madawa nje. Ukituma madawa unaendea nje. Lakini kutoka tulitumia linda mama. Ilifika time nikaenda incubator. Nikasikia daktari akiniambia wakisema mtoto si wa mashini wa mama. Hapo nilienda kangaroo.
The neonatal unit at KNH handles a large number of premature babies. Dr. Wayego's team faces the challenge of providing life-saving interventions such as mechanical ventilation, continuous positive airway pressure or CPAP machines, and strict infection control measures. A key component of their care strategy is kangaroo mother care, a method that involves skin-to-skin contact between mother and baby. This helps regulate the infant's body temperature, promotes breastfeeding, and enhance overall growth.
We have a continuous kangaroo ward that has a 10-bed capacity, but even the babies that are in the newborn unit admitted, we also do kangaroo well.
According to a study by UNICEF, kangaroo mother care has been proven to reduce the risk of infection and mortality and improve neurodevelopmental outcomes for preterm infants.
So from the total number of babies that we admit in the newborn units, anywhere from 25 to 30% of the admissions are usually premature babies. And these are babies that are born here in our facility at the referral hospital that you're working in. But we also get to receive babies from across the country.
So ndio nifike hapa nimejifunza vitu mingi. Venye nambeba namsaidia, maybe anaweza sahau kubreathe. Through my energy namsaidia kubreathe. So ana breathe vizuri na anapata joto. So height inaendelea kuwa poa. Juu hiyo ndio sana inatakikana hapa.
Despite these advancements, the healthcare system faces significant challenges. Preterm infants require a level of care that demands highly trained staff, specialized equipment, and extensive medical support. These resources are often stretched thin, particularly in smaller hospitals in rural areas. One of the critical factors contributing to the rise in premature births is the increase in risk factors such as maternal age, which could either be below 18 years or above 40 years of age, gestational diabetes, preeclampsia, multiple pregnancies, infections, and lifestyle choices such as smoking or drinking alcohol. According to a report by the Kenya National Bureau of Statistics, KNBS, and the Kenya National Health and Impact Survey, KNHIS, several socio-economic factors such as teenage pregnancies also play a significant role.
Approximately on a monthly basis, we have about 150 to 200 admissions in the newborn unit, and in those admissions, approximately maybe 30% would be babies who are preterm. And some of them maybe it's a single baby or sometimes multiple.
While healthcare interventions are crucial, the emotional journey of mothers who give birth to premature infants is equally significant.
The moment umekaa na umepata akiwa poa, uende hapo nje hapa uende choo. Kurudi unapata mtoto in another situation. Na ilinihapenia tena jana usiku. Nilikuwa blessed feed hapa vizuri. All of a sudden kumekelea hapa, you can see here niko na oxygen. All of a sudden ameshindwa kubreathe.
According to UNICEF, over 13.4 million babies are born prematurely every year worldwide, with sub-Saharan Africa and South Asia bearing over 60% of this burden. Preterm birth complications are the leading cause of death among children under 5 years of age. In 2019, over 900,000 preterm deaths were recorded worldwide. Across the world, groups for affected families of preterm birth have been at the forefront of advocating for access to better care and policy change while supporting other families.
Part of the campaign globally, what we are talking about, every woman, every newborn, everywhere. And the emphasis being the interventions that we are doing for preterm babies to ensure that they thrive, they survive, they thrive, and they are able to achieve their potential in life.
The past decade has also seen a growth of community activism on preterm birth and stillbirth prevention, driven by networks of parents, health professionals, academia, and civil society. Chebet Birir, KTN, Nairobi.